tested at the slightest onset of symptoms. Get tested if you know that you've been at the exposure sites, which continue to increase in number and are updated regularly and can change based on new and different information. There were also a record number of vaccines delivered through state-run clinics yesterday. 31,629 Victorians were vaccinated in our state-run centres yesterday. I'm sure that's the first, but it certainly won't be the last day in which the state clinics pass 30,000. Add to that the great work being done by our GPs, our pharmacists, and our community health partners. We continue to see increasing numbers of vaccinations every day throughout Victoria. Today, of course, speaking of vaccinations, is day one on which Victorians 16 years and over can access vaccines recommended for their age groups through state-run clinics. And to just recap on that, people who are aged 16 and 17 through those state clinics are now eligible for Pfizer vaccines. People aged 18 to 59 are eligible for either AstraZeneca or Pfizer through state-run clinics, and people aged 60 and above are eligible for the AstraZeneca vaccine through state-run clinics. We have seen an absolutely extraordinary level of influx of bookings through our state-run clinics this morning, and we've seen the system put under substantial pressure, but at the same time we've also seen huge numbers of bookings being made, and Naomi will go through both those pressures and those arrangements in more detail shortly. What is fantastic is to see so many people who have become eligible under the announcements made by the Premier yesterday want to be part of recovery of our way out of this pandemic through the vaccination program. And I would encourage everyone to both continue that enthusiasm but maintain their patience as we work our way through that extraordinary level of interest. Kate Matson, Deputy Secretary, will also provide more detail in regards to some of the detail behind the numbers of the COVID cases in the community at the moment. But whilst it's heartening to see a reduction over the last couple of days, we know that numbers bounce around, and it is the trend that the public health officials in particular frame their advice to government and their decisions around. And it's our public health officials who still tell us there is a lot of work to do to make sure that as we take vaccination rates up, we bring infection levels down. And chief amongst our concerns at the moment continue to be those high-risk areas of transmission in and around the Newport cluster and the Altona North group, the steady rise in mystery cases every day, even though further work quite regularly over subsequent days brings those cases down out of the mystery category, and of course the numbers of days of which people are infectious in the community before their status of being COVID positive is confirmed and they go into isolation. And of course we also continue to be active in support of the Shepparton community, and I want to thank the people of Shepparton for their outstanding support for Goulburn Valley Health. I want to thank the other health services and local public health units and the Australian Defence Forces who have stepped up to be part of that support for the Shepparton community. And I want to particularly thank all the civic partners, the social organisations, the food providers, the care providers who have all stepped forward in record numbers given the amount of personal close contacts and secondary contacts that we're seeing in the Shepparton community. And lastly, I want to thank our health services, which continue to be under pressure and which we've seen some numbers of healthcare workers, either as a result of their being in the community and having their kids or their families exposed to schools and other areas of exposure sites, or their own workplace coming as exposure sites. And we're seeing those workforces being under pressure, but I want to thank the wider community of our healthcare professionals, our healthcare workforce, for doing all the hard yards for keeping our health system functioning. And I want to thank the people of Victoria to continue to follow the rules, to continue to take the opportunity of getting vaccinated when you can, and to make sure that we all do our part in driving down infections and getting us to the other side of this global pandemic. I'll ask the Deputy Premier and then Kate and Naomi to say a few words as well. Thank you.
Terrific. Thanks, Martin. Good morning, everyone. So as the Premier said yesterday, we've been working hard on plans to vaccinate both students and staff over the course of over the next few months. Of particular concern and priority for myself as Minister for Education and the government are our Year 12 students in their final months of their schooling life. We've already announced a range of supports and initiatives, plans in place to give our Year 12 students some confidence and clarity about what the rest of the year looks like. So from Monday, there can be school-based assessments on site in small groups if they can't be done online. We've got the GAT confirmed for the 9th of September. We've got our exams as scheduled from October 4 right through to the 17th of November. And we've also confirmed that the consideration of educational disadvantage, that is every single Year 12 student, the impact of the pandemic will be taken into account for them as individual students. It worked last year and it will work again. So all of those things give confidence to our Year 12 students as they look towards their final exams and life beyond school. But we also know that the path through this pandemic, the path out of this pandemic, is via vaccinations. So today I'm announcing that as part of the expanded eligibility vaccination program that the Premier announced yesterday, I can announce that the priority for us is to make sure that all final year students have received their vaccination before they start sitting their exams on the 4th of October. That is our priority. Everyone 16 and over, but particularly those Year 12 students, we want to make sure that they're vaccinated before their exams start. Whether that's through the many state vaccination hubs we've got across Victoria, whether it's through GPs or whether it's through participating pharmacies. As the Premier has also outlined previously, we also want to make sure, we also want to see that 12 and older, kids 12 and older are vaccinated at least with their first dose by the end of the year. But that is, of course, subject to one, ATAGI advice, and secondly, to supply. So there will be very strong communication to all students and staff across all our schools in Victoria, but a particular message to our Year 12 students, but also VCE staff and staff who will be supervising the VCE exams. We also want them to get vaccinated. So please get vaccinated as soon as you're able. Make a booking. As the Minister has just outlined, there's a lot of pressure on the system right now, which is to be expected, so please be patient. But we do have a priority to make sure that all Year 12 students are vaccinated by the time we start sitting exams on the 4th of October. The other reason I'm standing here today is I'm very pleased to celebrate what is quite frankly outstanding NAPLAN results for Victoria. Victoria leads the nation, and you think about all the challenges that we've faced as a state, you think about the many months that students have been in remote and flexible learning. To have these results is just a brilliant outcome and is testimony to the hard work the resilience of our students, the expertise, the dedication, the passion of our teachers to get us through this last 18 months and to come up with NAPLAN results that clearly lead the nation is just fantastic. And that's right across all our schools. Government, Catholic and independent schools have done a great job. So to run through those very briefly, in Year 3, we lead the nation in reading, numeracy, grammar and punctuation. In Year 5, we lead the nation in reading, numeracy, writing, grammar and punctuation. In Year 7, our Year 7 cohort in Victoria was the only cohort in the country to improve reading, and we've got the highest scores of any jurisdiction in reading and numeracy, and our Year 9 students topped the nation in spelling. The whole time I've been Education Minister, I've been very clear to say that NAPLAN is not everything, but it is important. It does tell us how we're tracking as an education system, where we're going well and where we need to make some improvements. And it's not just about statistics and numbers. Behind every number is a child. And we've got to do everything that we can to provide our children, our students, with the skills that they need to thrive in life. And these NAPLAN results show that our education state reforms that date back to 2015 are delivering. It's making a profound impact for our Year 3 and Year 5 students, a massive jump of almost 10% of students into the top 2 bands in reading. That's more than 13,000 kids, more additional students moving into the top 2 bands excelling in reading. But just as importantly, more than 8,000 Year 5 students are climbing out of the bottom 2 bands in reading, giving them the foundation skills that they need in literacy and numeracy to thrive in life. So in closing, this is a message of thanks, gratitude and well done to our Catholic, government, independent schools, to our dedicated, passionate, expert teachers, to our 6,400 tutors that have been supporting kids who have been falling behind, to our families, parents and carers who've had to juggle working from home as well as taking care of their kids, and most importantly to our students. This is a wonderful result. You should be so proud of yourselves. Well done. I'll now hand over to Naomi as it starts raining. We'll get through the rest of this quite quickly to go through vaccinations.
Thank you, Deputy Premier. Yesterday was a record day for our vaccination system. 31,629 vaccinations, and that's 31,629 Victorians who have come forward to get the jab that is our way out of this pandemic. 2.2 million doses have been administered in our state system, and that's really only the start. We have had an extraordinary response to the changes to eligibility that were made yesterday. This change makes the message really clear. Every Victorian 16 years and over is now eligible to be vaccinated. It really is that simple. Now this morning, it has been very busy on the system, but 25,000 bookings had been made by 9 a.m. this morning. 18,000 through the online booking portal and 7,000 through the call centre. Tens of thousands of Victorians are trying to book in right now. We've had over 1.3 million people trying to call the call centre this morning. And our online booking system is receiving 50,000 hits per minute. So it is slow, it is busy. Please be patient, please be kind to our staff, but people are getting through and making those bookings, which is really fantastic. There are still plenty of appointments available. The Premier talked yesterday about 830 appointments between now and the 17th of September. Now, many of those are filling up really quickly. This morning, when I looked at the system, there were 300,000 appointments available between now and the 17th of September. But as I've said, the system is really busy and those appointments continue to fill up. We will continue to take every single dose that we have in Victoria and turn it into an appointment so a Victorian can book into that appointment. Just really briefly, we are excited to be launching the drive-through at the Wyndham Eagle Stadium today. That's another one of our drive-through sites, so there's now 4 in total. fantastic access for people in Wyndham, Melton, Hume and also down at Sandown Racecourse. A particular shout out to people of the West. There are lots of appointments available in Melton and Wyndham. Really recommend that people in those areas jump on the line and try and have a look because there are lots of appointments available. And just really quickly in the rain, we do have our aged care and disability care blitz happening this week. So if you are a staff member in a residential aged care facility or a residential disability facility, you can walk up anytime to any one of our state clinics and you will be prioritised. So please come forward and take up that opportunity. I'll hand over to Kate Matson.
Well, I might just intervene and, given Melbourne's unpredictable weather, encourage us all. Please my apologies to everyone. The weather's caught us. We're just going to relocate to undercover and then we'll keep going. We want to make sure our friends for the journalists don't get saturated. Thank you very much. We'll just take a quick break.
You really want
Oh, actually, sorry, I'm going to be over here now, just so we can swap a bit easier.
Oh, all right.
Rather than,
Yeah.
sorry.
Doable?
Is it?
No,
It's not doable.
I don't. I think the
Well,
camera would
come
need to.
really close.
Yeah.
Like where that microphone is.
Where the
that's
microphone
we need
is?
you standing.
Yeah, right.
You'll let me know when you're right to go.
Yep. How we going? Is everyone up? Or-
Right to go?
Hang on.
Right.
Sure, the phone for it, sure, if it's helping out.
Sorry, just give me a seat. Next line, are you still seeing 3 feet from ABC 7 and 9? Tell all the channels to get underway now.
Yeah.
Yeah, we're good.
Yep, awesome. Thank you.
Okay, right to go. Sorry for the brief interruption, everyone, but it's one of the reasons we all love Melbourne. I'll break down our cases today. So, as the Minister mentioned, we have 45 local cases. Of those, 9 are currently unlinked, and they're from a range of areas around the greater metropolitan area, including 2 from Hobson's Bay, and cases in Hume, Melton, Wyndham, the city of Maribyrnong, Moreland, Monash and Glen Ira. Of the other cases, 10 are linked to the My Centre Broadmeadows outbreak, 9 to Shepparton and the Royal Melbourne Hospital outbreak, 4 to the Hobson's Bay Wyndham cluster, 2 to CBD North Melbourne, 1 to Glenroy West Primary School, and the further 10 cases are household contacts of unlinked cases that we've announced in previous days. Of the 45 new cases, 17 have been in isolation for their full infectious period. We've now got more than 17,400 primary close contacts related to this outbreak and 15,700 secondary close contacts. As the Minister mentioned, we had over 53,000 tests yesterday, and again, thank you to all those Victorians who came forward to get tested. And thank you to the nurses, the pathology labs and everyone involved in our testing network across Victoria. We're still seeing terrific performance with test turnaround times, 97% still being returned the next day, and over 800,000 tests since the beginning of this outbreak. In terms of our wastewater detection system, we are still seeing pings in that West Sunshine industrial area. And I'm pleased to be able to say we've been able to narrow down that catchment further due to terrific work from the department's wastewater team, as well as our partners at Greater Western Water, Melbourne Water and Australian Lab Services. So again, thank you to all of those. We're narrowing down that catchment and shrinking the net, if you will. I mentioned a couple of days ago that there are 120 businesses in the area of concern, and now we're able to narrow it down to approximately 50 to 60 businesses. So our teams will be working collaboratively with WorkSafe, the Department of Jobs, Precincts and Regions, to go door to door and really make sure that we are testing everyone in that area, given we still haven't been able to locate the case that works in that area. Yesterday, Jerome outlined a number of areas of concern, and I'll just touch briefly on 3. The original outbreak related to Altaqua, Caroline Springs, Glenroy, etc. We've now got 361 cases in total, including 11 that we've just announced. And while it is linked to Glenroy, separately we look at Shepparton and the Royal Melbourne, 66 cases in total there, including 9 new in the past day. We've got our other areas of Melbourne, inner city, etc., St Kilda, inner south, as well as CBD, North Melbourne and Brunswick, a total of 69 cases there, 2 new in the past 24 hours. And then, as we've been discussing, the Hobson's Bay, Newport, Wyndham, Altona North areas. 84 cases in total linked to that, including 4 in the past 24 hours. Of those currently unlinked cases, it's an increase of 9 today, but I expect further 20-odd cases to be linked throughout the course of the day as our teams work through contact tracing efforts. Most of those, I hope, should be linked to Shepparton, the Royal Melbourne and the Newport clusters. We've discussed a little bit about why we're still seeing, a stabilisation of cases, I beg your pardon. We know the attack rate in household is very, very high, and entire households will catch this virus. And this is one of the reasons why, of course, lockdown and the restrictions help, because it helps minimise movement. The cases we are seeing are usually permitted workers, healthcare workers, people who work in construction and are out and about. This also reiterates why getting tested with symptoms is always our number one message, but more specifically, please get tested as soon as you develop those symptoms, that day or the next day if it's too late in the day to access a testing site. Some of the recent cases that I've mentioned haven't been tested for 7 or 8 days, and our average of our unlinked cases, of course, our primary close contacts that are easily linked can be tested really, really quickly or on their day 13 test if asymptomatic. But our unlinked cases, 7 days and an average of 3 days. If we shorten that, we will be able to get on top of this as soon as we possibly can. That's represented by the fact that of today's 17 cases that have been in isolation during the infectious period, 10 of them relate to the My Centre Broadmeadows. That's a great example of our contact tracing teams getting on top of and isolating what we know about it. If we don't know about it, we can't isolate it. So please get tested the day or as soon as you develop symptoms. Again, the message around vaccination that the Deputy Premier, the Minister and Naomi have all shared is a really key one. Even if you're vaccinated, please still come and get tested. Although your viral loads will be lower, meaning you're less likely to transmit it to other people, you still can do it. It is still really important, even if you're fully vaccinated, to get tested. And again, that vaccination really helps with the rate of serious illness. The Minister mentioned 36 of our cases are in hospital. None are fully vaccinated. 2 have had 1 dose. So again, please, I share that message. Get tested, get vaccinated, and that will help us move forward out of these outbreaks. I'll pass back to the Minister for questions.
Minister, the situation in Shepparton is quite dire at the moment. There are a third of the population in isolation. Some supermarkets are having to shut early because they don't have enough staff. People actually can't get food. The council there is calling for urgent resourcing. What are we doing about that?
So we're well and truly engaged with not just Goulburn Valley Health, the council, the aged care services, the school services, the civic support groups, the food supply groups. We know that the people of Shepparton, because of the way in which this outbreak has played out and caught so many as either direct personal close contacts or secondary close contacts, that there's more effort being put in. So we're working through all of those issues, be it with the hospitals, the aged care centres, the food distribution chain people, the whole set of supports to make sure that the people of Shepparton and the Goulburn Valley more broadly get all the support they need. It's a challenge, but it's a challenge I know that the people of Shepparton and the people of Victoria are up to.
So are we sending more workers, or are we sending more workers, or do we?
Well, in regards to healthcare workers and the ADF and other particular arrangements, absolutely we are. And we'll work through all of those other issues with council, with industry, and make sure that the people of Shepparton get through this very challenging time.
There are reports supermarkets have had to close early, for instance. Is there anything you can do in terms of getting more supermarket workers?
We'll work through all of those issues with industry and the particular providers. I'm not briefed on that particular matter, but if there are measures that need to be taken, of course they'll be taken.
How many more healthcare workers are being deployed to that area?
Well, we've asked and got good support when it comes to the health provision and the support that's been asked for there. They've stepped up, whether it be through support in Goulburn Valley Health and other areas around making sure that the testing and the compliance and support for people who are isolating is all provided, together with substantial numbers of authorised officers, council support staff, civic support from all sorts of local and wider regional supports. People have stepped up from Bendigo Health, from some of the city health services and other arrangements to make sure that the huge level of demand on both the health services and wider services that the Goulburn Valley is under is got through.
But will you possibly have to boost numbers even more, maybe for the testing clinics, or if supermarkets are closing and so many staff are off, will you ask for ADF support in that respect?
Well, we're in constant work through the state control team every morning with the Emergency Management Commissioner, who's the link between Victoria and the ADF. and that's been working well, and I'm sure if the call is made for further ADF support that it would be provided.
How many extra healthcare workers are being sent there?
I don't have that exact number, but it's a substantial number. We've seen quite a few people from Goulburn Valley Health furloughed, mostly because they're community members, their family, their kids are at the schools that have been nominated as primary close contacts, and we've seen a smaller number, but not an insignificant number, exposed through being primary close contacts at different health settings, particularly the Mansfield case and a couple of others. But overwhelmingly, it's as a result of people being primary close contacts in their own community.
Minister, Shepparton's got quite a large Indigenous population. Have there been any cases in that community?
Can I give a particular shout out to Rumbalara, the Indigenous community organisation that covers so much of the Goulburn Valley and the Hume area. To the best of my knowledge, this was last night, there had been no cases amongst the Indigenous community in Shepparton, and I think that speaks volumes as to the way in which those Aboriginal controlled community health organisations have been able to engage with their community to keep them safe, and we want to thank them, and of course we support them in any way we can to keep that record going.
Questions? How will you achieve that goal of trying to get Year 12s vaccinated by October 4? Will you bring the vaccines to the schools?
So we've made, firstly, the priority, the aim to make sure that all Year 12s are vaccinated by the time they start sitting exams on the 4th of October. So we've got some time. You know, it's the 25th of August. The target is to make sure they're vaccinated by the time their exams start, and my department is working very closely with the Department of Health and the Public Health team, keeping a close eye on how we're tracking. If there are ways that we can support students to get vaccinated, we will, but the best thing to do, the quickest path to 70% and then 80% is the broad expansion of eligibility, which is what the Premier announced yesterday. And in terms of that broad expansion, what we're going to do in education, working with our schools, directly communicating with families, with students, with principals, is to say if you are in Year 12, if you are a VCE teacher, if you are going to be supervising exams, get vaccinated as quickly as possible.
So other than telling people to get vaccinated, are you doing anything else to help Year 12 to get out?
Well, we're making it clear that is our priority. We want students 12 and older by the end of the year to have at least one dose. We have set ourselves the target of having Year 12s vaccinated by the time exams start, and we're working very closely with our public health team to make sure that we can do that.
And that's double vaccinated, so you say you've got a bit of time. If it's double vaccinated, it's...
Well, this all comes down to, as we have said right from the very start, as the Premier made it very clear yesterday, we are significantly expanding eligibility. We have the confidence to do that now, but if we're going to deliver it and deliver it on the timelines that we have set, then that is dependent on the supply that comes from the Commonwealth. So we'll be asking the Commonwealth for additional supplies of the vaccine. We want our Year 12s vaccinated. We want at least one dose for kids 12 and older by the end of the year, but that is going to be subject to supply, and for the younger kids, Targi advice.
So you've set this without actually having the supplies set in stone?
Oh no, when the Premier announced the eligibility expansion yesterday, that was some 2 million additional people. We've got confidence immediately in the supply, but in terms of delivering it, as we said yesterday, this is dependent, and it's the responsibility of the Commonwealth Government. We need that supply. As soon as we get it, we'll be putting it in people's arms.
Are you considering maybe like a special queue for Year 12 students at vaccination hubs?
Not making any announcements today. We're working very closely with the public health team in terms of how best to support all students and staff, but particularly Year 12 students. We're going to make it clear. So this is about sending a very strong message to Year 12 students, particularly in their final months, giving them confidence and clarity that they can, really tackle their last few months of study and give it their best shot. We've got the consideration of educational disadvantage, so every single individual student will be assessed and the impact of the pandemic will be taken into account with their results. School-based assessments are resuming. We've got the GAT on the 9th of September and exams as scheduled. This is about giving Year 12 students confidence, and we're making it very clear in an education space that we want firstly Year 12s vaccinated by the start of exams.
Given Pfizer has been spaced out to 6 weeks, it's probably not possible to get everyone vaccinated fully by that date. Are you going to make it 3 weeks for Year 12 students?
We'll continue to work with public health. We want as many students as possible vaccinated. Fully vaccinated, obviously, you know, this is all our aim. We know that vaccination is our pathway out of this pandemic. So we'll do all we can. We want our Year 12s vaccinated by the time they start sitting exams.
How many more doses are you asking for, or is that a draw forward of another month's supply?
I haven't got a figure in terms of exactly how much we need. That will be determined, obviously, by how quickly we can get the vaccinations, whether it's through our state hubs, whether it's through GPs and pharmacies. We need people to be patient. We know that there's massive interest and people trying to get through and make a booking and get vaccinated. In terms of the exact numbers, we'll announce that, but we will be asking the Commonwealth for additional vaccines.
Is there any way of doing group or family bookings? Because some parents that have been able to get through this morning can have booked in for one child, have had to wait to do another, haven't been able to get through.
It might be worth whether it's Naomi to answer that question on the process.
One quick one, just on the GAT. That's in about 2 weeks' time. Will that happen regardless of how many cases there are, and how are we going to do that safely?
Well, again, as we have done throughout this 18 months, you know, whenever we announce a plan for schools, it is always subject to the epidemiology of the time and the public health advice of the time. But DET and public health team have been working hand in glove in terms of our plan for schools. So it's scheduled to go ahead on the 9th of September. In terms of all the arrangements about how we can do that in a COVID-safe way, public health and the Department of Education are working closely and will provide clear advice to schools as to how it should proceed. So right now, school-based assessments, if you can't do it at home and online, they can be done on-site from Monday, the GAT on the 9th of September, and exams as scheduled from the 4th of October.
NAPLAN results. Is the results a reflection of parents having to be more engaged in their kids' learning?
Simon, I think it's a number of things, and you know, it truly is an extraordinary outcome when you think about the time our kids, Victorian kids, were in remote and flexible learning. It points to, firstly, the expertise of the profession. You know, they've been forced to teach in a way they've never had to teach before. They've been innovative. They've worked out how to engage best with students. So first and foremost for me, it's our teachers, it's our support staff, it's the 6,400 tutors we've been deployed out to schools across the state for kids that have fallen behind. Then it's parents and carers and families and the love, the support. You know, there are hard days for parents, particularly with younger kids in the household, for students that have really struggled with their mental health and well-being with remote learning. So a massive effort by parents and carers. And finally, it's our students. You know, we see how resilient our kids are. To be #1 in the country after the last 18 months is just extraordinary.
You've had criticism on NAPLAN in the past, though, so now are you all for it?
Sorry, Simon?
You've had criticism for the NAPLAN process in the past, though, so you're now all for it? Given
No, I've always said, and every single public comment I've made is that we will always need a universal testing program to ensure that we can track how we're running as a state and as a nation. I've been advocating for improvements to NAPLAN, how we can make it more engaging and meaningful for our Year 9 students. How do we expand it beyond just literacy and numeracy? But NAPLAN itself, it's not the be-all and end-all, and I've never said that it is, but it is important because it helps us with where we're going well and where we need to have improvement.
Based on today's case numbers, when do you expect schools to be back?
Look, I want students to return to face-to-face learning as quickly as possible. That's what every teacher wants, every student wants, every family wants. It is always and has to be subject to public health advice. So, we're in this period of lockdown, 5 reasons to leave home. That will continue through to the 2nd of September. In that lead up, we'll get advice from public health in terms of what that means, what does the future hold for our schools. But I want kids back at school as quickly as possible. But the reason we've got remote and flexible learning for most of our kids is because to tackle an outbreak, to get on top of the Delta variant in particular, you've got to restrict movement of people. And when you've got all students, families, teachers dropping kids off, you're talking about 1 million students and hundreds of thousands of other adults moving around the city and the state. And we just can't afford that right now.
Is there anyone desperate for some form of roadmap, some form of indication of when schools can reopen? Is there one particular thing they should be looking at to give them an indication that it's getting close? Because they're understandably desperate. They want a roadmap.
Yeah, look, we all want our kids back at school, and as the Premier, the Minister, our public health team, it's looking at the numbers, but also the story behind the numbers. How many are infectious in the community? Where do we have concerns? And then we get advice from public health in terms of how we can have students returning back to face-to-face learning. I can't give a date today. It would be inappropriate. I just cannot. We've got to get on top of this outbreak. In the meantime, our teachers are doing a brilliant job. Our kids are resilient. We see that in today's NAPLAN results.
The rate of improvement from year 3 to 5, 5 to 7, then 7 to 9 from Victorian kids was the worst of any state in terms of last test result to this one. Is that a potential indicator of the impact of remote learning in our state?
Look, there's a lot of positives, and I'll come to progression. So we've seen years 5 and 7 jump to number 1 in reading. Our year 3s were number 1 quite strongly in the last round. So when you've got really strong performance at the top of the nation, you're not going to see the massive progressions that you might otherwise see if you are 3, 4, 5, 6 in the tally of where you sit with those numbers. We've also seen, as I said, these are extraordinary results given the impact that the pandemic has had, particularly on Victorian students. You think of the time that they were in remote and flexible learning throughout last year and into the early parts of this year prior to the NAPLAN test. So putting all of those things together, this is without doubt an extraordinary result.
It's terrific. We're still number 1 in many areas. Everyone's happy about that. But it is a fact that our rate of improvement from the last test to this test was the worst of any state. Surely you should acknowledge that is a potential indicator of the impact of remote learning, and that it's a sign that we need to get kids back to school.
Look, when you think about the period of remote learning, and I was anticipating what the results may be out of NAPLAN, you would think of any year, this would be the year that we might struggle and we might go backwards. We have not, and that is a major victory for our kids, for our families, for our schools, government, Catholic and independent. When you are number 1, progression, the jumps in progression are not as great as when you are not number 1. But we've seen improvement. We've seen us jump to number 1 in reading in years 5 and year 7. We were the only year 7 cohort in the country that improved in reading. The only year 7 cohort in the country that improved in reading. So I think when you look at the data as a whole, this is a simply brilliant result.
So getting back to school, lots of Western European countries and parts of the US are now mandating ventilation measures in schools. It's kind of seen as the pathway to getting schools back open. How developed is the thinking in Victoria on that front? When will we start mandating CO2 filters? Where is that policy at?
So I've got no announcements to make, obviously, today beyond what I've talked through. But in terms of ventilation, there is existing advice and guidelines to school in terms of how to how to operate in a COVID-safe way, and ventilation is an important component of that. We're working closely with the public health team, as are different parts of government, thinking about as we move to a COVID normal. You know, this virus is going to be with us for a long, long time, but as we get to 70% and 80% vaccination and a pathway to some normality, all of those issues will be considered about how we operate, how we live, work, study, once we get to those vaccination levels.
No urgency on those fronts? Why are we not thinking
Just
about
because I don't have an announcement today doesn't mean that there's work not happening.
Is it, in your mind, is it an urgent issue to get ventilation right in school so we can get kids back this year, this calendar year?
Well, as we've seen, whether it's hotel quarantine and the ventilation assessment and the work that was done to make improvements to ventilation, it is important. So we are. All of those things are being considered in terms of how we move to COVID normality and move away from statewide broad lockdowns.
When is decision day on the grand final? It's about just over 3 weeks away. When is the government going to give the AFL an indication either way of what the decision is?
There's current engagement now with the league, between public health, major events. In terms of when a decision's made, I can't give you an answer to that.
It's a hard sell though to have a crowd at the grand final given the situation we're in now. Is it time to just call it?
Well, we've got a lockdown to the 2nd of September, and all of our focus is tackling that outbreak and then getting some advice from public health as to what the next steps will be. You know, those decisions will be made in the course of that time.
Can I ask you a non-education question? I know we've got the Minister, but you're in the crisis cabinet and I think you're well equipped to answer. Has the government started thinking about freedoms for vaccinated people at around the 70% mark? Are we thinking in that space, or has the conversation not moved to that area yet?
In terms of people that are fully vaccinated?
Yeah, in Victoria, like New South Wales is considering.
Look, it'd be more appropriate for the Minister for Health to respond to that question. Anything else on education?
I just want to clarify, families that for whatever reason don't want their VCE child vaccinated, will there be any penalties, any repercussions for them?
No, there won't be. No, exams are scheduled from the 4th of October, performance and oral exams, and then later in the month, the big written sitting exams will take place. All students scheduled to perform or to sit their exams will do so.
So this won't have any effect?
No, it won't.
And just on that online booking system again, it's still taking some people more than 4 hours to get an appointment for Pfizer. Why weren't the systems in place to deal with that influx of demand prior to it being announced?
I think when you look at the scale of the announcement, the increase in eligibility, there was always going to be a significant spike in people wanting to make a booking, and we just ask people, as the Minister and Naomi have said, ask people to be patient. There will be some delays, but it's just so important, and we know this demand is there because people know that a vaccination is the pathway out of this pandemic.
And have you given any further thought to prioritising other groups of essential workers, teachers, supermarket workers, not just those Year 12 students?
No, as I said before, the quickest way to getting to 70% and then to 80% is a broad-based eligibility. So the announcement that the Premier made yesterday is the quickest way to get to where we need to be for everyone, whether it's teachers, supermarket staff, other frontline workers. The best way to get to 70 and then to 80% is broadly increasing the eligibility, which is exactly what we've done. But ultimately, success will depend on whether we can get the vaccine supplied by the Commonwealth.
Just before we go back to the Health Minister, sorry, on your other portfolio, mental health, in your conversations with the industry throughout this most recent lockdown, is the situation worse than it was last year? What's your sense of the mental health burden at the moment?
I think there's cumulative fatigue it gets tougher the longer the pandemic goes on. It's harder for people, and you feel that yourself. You feel that talking to friends and family. You feel that talking. When I spoke to a group of principals yesterday, and they talked about that. It's just getting harder and harder because of the length of time. So that's a broad answer in terms of mental health and well-being. In terms of the data and what we're seeing, we have always known that this would have an impact, the pandemic, and then our response, the public health response to the pandemic. It has a social cost, it has an economic cost, it has a mental health cost. And you saw that through the course of last year. Increases in presentations to emergency departments with mental ill health, suicidal ideation, an increase in eating disorders in young people. We didn't see it reflected in suicide deaths, so the numbers last year were stable compared to previous years. In fact, they were a little bit less, but there's no doubt that there's been a mental health impact, and those ED presentations, eating disorders, they remain high compared to 2019. And that's exactly why the Mental Health Royal Commission is so important. The $3.8 billion we invested in the May budget, $225 million directly, in addition, directly to respond to COVID, whether that's increased clinical care. We've got a blitz with people on a waiting list at Headspace, young people at Headspace, direct support to Eating Disorders Victoria, Lifeline, Beyond Blue, additional support for schools. We're rolling out mental health practitioners in our secondary schools right now. We'll conclude that by the end of the year. And we've got a massive $200 million mental health fund for schools that will start from next year. So there's no doubt all aspects of our lives have been impacted by this pandemic, but there is no choice in terms of the public health response, because if we don't tackle the outbreak, then it explodes. And it explodes in hospitalisations, in deaths, and the mental health impact would be infinitely worse for Victorians.
Do you think that the extremely tough lockdown we're in now, where you can't go to a playground, can't do lots of other things that you could do in our lockdown light, if you like, do you think that alleviating the lockdown burden, doing the Tony Blakely model of going to a kind of a stage 3 lockdown for the next month or two, could that ease the mental health burden?
Well, of course, that makes common sense. You know, as you ease restrictions, as the public health advice and the way that we deal with the outbreaks, as you get public health advice that you can then ease restrictions, then of course that helps in broad well-being of our communities, of families, and it helps in our mental health well-being. But as much as we want to get there, that's the enemy is the virus. The enemy is this Delta variant, and we've got to get on top of that, because if you don't, the mental health impact would be so much worse than what it is right now.
If you go to the Minister just quickly. Minister, has the government started thinking about potential freedoms for vaccinated people at the 70% mark?
Well, as you know, the National Cabinet's decision on the 4 phases of transition out of the pandemic into a COVID-safe world has as a key part of it the measures that will kick in at 70% consistent national coverage of double-dose vaccines and then 80%. Victoria, Tasmania, the Northern Territory and the Commonwealth are working through precisely what that looks like. I've got to say, the enthusiasm that's come from the private sector, from community organisations and others who want to be a part of that makes us more certain that that strategy is correct. We'll work through that process. We want to make sure it's a consistent national process, but if there's particular Victorian additions that could be put onto that, we wouldn't rule them out, but we are a key part of making sure that we contribute to a consistent national approach on that.
There were any preliminary recommendations on Friday. Do we know what those recommendations could potentially be if it's Friday?
No, we'll let National Cabinet go about its processes.
Can you give any examples which you can dangle almost like a carrot? Just anything that would indicate the type of things that are being considered, Minister?
Let's National Cabinet go through its processes, but what we do know is that there is both a positive incentive for people to get vaccinated because it will be our ticket to a whole range of things that we all love doing that we can't do at the moment. And there will equally be a positive disincentive for people to hold back from getting that vaccinations, unless they're that very small number of people who have a health or other legitimate reason for not being vaccinated, and we need to look after them in that process.
Surely a vaccine passport for the pub, you could actually have to show something.
I'm not going to rule anything in or out, but we've seen so much enthusiasm from different parts of industry who see this constructive engagement as a way to open up. And yes, it is an important part of that process. It's critical, but from a public health point of view, it's also not the only issue. We've also got to maintain a whole range of other measures in a proportionate sense based on all the factors that went into the Doherty Institute's modelling about what 70 and 80% looks like. When you get to 80%, it's not throwing open the doors. There's other alternative modelling out there that talks about some of the, if you just threw open the doors, as we've seen in parts of the US, in parts of Northern Europe, and in parts of other parts of the world, if it's an unsophisticated one measure only, you will see hospitalisations rates go through the roof. You will see deaths once again go through the roof. And we are not going to be part of that. It's a package. Good, sensible measures that can keep COVID-safe practices that are attached to those measures of how we reopen cautiously and carefully when we're in a position to do so.
The UK's opened up without any rules about a month ago, and cases are relatively stable. They are 30,000 a day, but they're not 60,000 like they were in January. Is it fair to say that there is a chance of actually keeping things open if there is vaccination coverage?
So the UK have come from a very different background of cases, deaths and other measures than Australia has. And in that regard, it's not quite comparing apples and oranges, but what you can compare is the fact of what happens, even in those circumstances, if you don't have measures in place that protect our health system. I did hear the Prime Minister indicate that he thought that the public health system was up for scratch to cope for that. I'm sure that we look forward to constructive engagement through the Health Ministers Forum and National Cabinet to demonstrate that. And I'm sure the Prime Minister will have opportunity to do that in coming days and weeks.
Do you foresee our border staying closed with New South Wales? Do you foresee our border staying closed with New South Wales for some time, given the amount of infection they have in the community?
Well, look, we've seen South Australia put in very tough measures with New South Wales and Victoria and other jurisdictions, but particularly tough with New South Wales. We've seen Queensland introduce further tough measures today on their Queensland-New South Wales border, and Victoria has always made its position clear. In a relative sense, our biggest threat is importing this virus again from New South Wales. This is where it came from in the last couple of incursions. We can't send it back. I wish we could. But what we can do is take all the measures that the public health team recommend to us to keep that border protection as strong as possible. And given the deteriorating position in New South Wales, I don't think I can rule out further measures being taken.
So we're following the lead of South Australia and Queensland on this when it comes to the border closure?
If you're in South Australia and Queensland with no cases, then you would be very jealously guarding that hard-won position. In Victoria, we are not at over 900 cases a day, that as I understand New South Wales reported today. All the projections aren't great in New South Wales and Sydney. We've seen it get out of Sydney into regional New South Wales. We've seen it get into far western New South Wales, up to the Queensland border, and creeping ever closer to the Victorian border. And I don't think it would be right or responsible for Victoria to do anything else other than taking all the necessary measures we need to take to keep the virus out of Victoria from further incursions.
Even after we hit 70 and 80% fully vaccinated, even after we hit 70 and 80%.
Well, 70 and 80%, I'm not talking in that regard, I'm talking in the here and now. The key thing to getting in the 70 and 80% is the very measures that the Premier announced yesterday and which Victorians have embraced so warmly today, is to get vaccinated, follow the public health rules and keep supporting all of those public health measures that will allow that combination of things to get us open. Clearly, the national 4-phase plan is predicated on ultimately a whole range of other measures coming in place. Victoria was a strong initial supporter of putting together the national 4-phase plan and continues to be a strong supporter of it. What that means, however, is that you have to take into account the circumstances at the time that you hit 70 and 80%. And we want to make sure that we support that goal by protecting that Victoria-New South Wales border as much as we can, whilst at the same time hitting the accelerator to get to the 70 and 80% vaccination.
So it's possible that border will stay closed past 70 and 80%?
Oh, well, how long's a piece of string? Let's see what the world is shaped. Let's see what the position in New South Wales is when we, as a nation, get to 70 and 80%. And that would only be the responsible thing for any government, state or Commonwealth to do.
Could this lockdown ease even if we have double-digit cases?
Well, we've always been clear. The public health advice is always nuanced around numbers and levels, and we want them as low as possible, but also the story behind those numbers. What are the exposure days? Are there mystery cases? Have people been isolating? What's the number of exposure sites out there in the community? Which particular communities, which particular parts of the state is the virus circulating or not circulating in? These are all really complex matters, and then you surround that with what's our level of vaccinations at the time? What's our level of compliance with the sensible restrictions that are still going to be needed no matter what for some time yet as we start to reopen at that 70 and 80%. It's just not possible on a day-by-day basis to give you the black and white assessment.
Okay, so what is the part of the story that worries you the most at the moment? Is it mystery cases, isolation, what?
All of those things, Nick. It's the combination of factors of unexplained transmissions, growing lists of exposure sites, the particular process of how people have been isolating, the time in which they're coming forward to get their tests, and at the same time, the protections that aren't where we need them to be for the vaccination rates. So it's no one thing, it's all of the measures coming together, and I share the public health team's concerns that it's the story behind the numbers as well as just the raw numbers.
Is it still very frustrating for you that 18 months on, people with symptoms are still delaying, we heard, up to a week in some cases?
Yes.
Have you figured out why that is and how you can fix that problem?
Frustrating is not the word. What we want is people to recognise that the contribution they can make to their own well-being, to the community's well-being, to their family's well-being, is to come forward and get tested. Some people are asymptomatic. They show no signs of the virus when they have it. Other people have very small symptoms. Other people are really not very well very quickly. So it's hard to just give a blanket description. But the consistent message needs to be, because of the way in which COVID can take off, particularly the Delta variant, if you've got even the slightest of symptoms, the sneeze, the cough, the tickle in the throat, the headache, the loss of the taste, whatever it is, that work on the basis that that's COVID, because there's not much flu out there, there's not much cold out there. If you've got any of those symptoms, you need to work on the basis that it is COVID and not just say, oh well, couldn't be me, this doesn't apply to me. It does apply to us all, and the best thing you can do is to come forward and get tested as quickly as possible. That will help our contact tracers. It will help the measures that we're all putting in place now through following the rules of the lockdown and get us out of this as quickly as we possibly can. At the same time, come forward and get vaccinated.
Could you give us a clearer indication of how many extra healthcare workers are being sent to Shepparton? Is it dozens, hundreds, and when? How soon?
Well, some are already there. Some have gone in as recently as soon as the outbreak kicked on, particularly in leadership, particularly in vaccination, testing and other supports. In regards to other measures, I can get to the particular figures. I did receive a briefing on that this morning, but we can get to those figures.
Just got a quick question for Kate, if that's okay.
Sure.
You said there were 9 cases linked to Shepparton and the Royal Melbourne Hospital. How many of those cases are actually based in Shepparton?
How many of the... just one moment. I'm sure I have that. It's an additional 4. No, beg your pardon, I'm trying to think. It's an additional 4 cases in Royal Melbourne. So we've got an extra couple of staff members and patients, and so the 5 will be Shepparton.
There's some exposure sites in the Geelong area, and we've heard of there's a household of 6 people in Lara that have tested positive. Can you explain how that fits into the wider outbreak?
Yeah, absolutely. We haven't linked that really strictly in an epidemiological manner yet, but we do believe it is related to the wider Newport cluster with respect to social and workplace and other links.
There were diversions away from the Royal Melbourne Hospital, we understand, overnight. Ambulances were redirected. How extensive has that been, and how much of an imposition is that on the Royal Melbourne Hospital and the way it's operating?
Yeah, I can't speak to the details around the operations of the Royal Melbourne, and I may ask the Minister to do that, but what I can say is that we've really looked very closely at our contact tracing definitions of the staff who need to be furloughed at the Royal Melbourne, and we've currently got about 300 staff furloughed, so obviously that will impact the health system.
How are you feeling about the number of mystery cases we've seen? How are we tracking? How concerned are you about today's mystery cases? What are your thoughts?
Look, one mystery case is too many mystery cases. So again, I would ask that anyone who has symptoms comes forward and gets tested, because then once we know about that, we can stop the downstream lines of transmission. So once we've been able to identify an outbreak, our teams work extremely hard. We contact trace, we go contacts and rings of contacts as we've done in the past. I think a really good example is the one I gave today. 10 cases related to my centre, Broadmeadows. 100% in isolation. That's where we need to be.
Kate, how confident are you that we will find the links for today's mystery cases? Because a lot of them are in suburbs where there are already known outbreaks.
Yeah, look, I mean, it's different for every single case, obviously, but again, we've already reduced the number of mystery cases over the previous days. At case rates in the sort of 40 and 50 as we've been seeing in recent days, it can take a day or 2 or 3 days to be able to link and ensure that we've got the right information through contact tracing. We often find, and we've been finding this for months, that in the first interview people forget things, people may forget to mention something, and as we dig a little bit further and we develop that rapport, we've got fabulous public health officers who are very well trained in this. They get little bits of information, we link it together, we check our QR code system, all of those things add up to helping to make those linkages, and we've linked dozens over the past few days. I'm sure if someone was to add up all the cases that we added up or announced as mystery cases in recent days, it would be a number far greater than the 46 that we've spoken about today.
And last week, I think Brett said that you were investigating a possible case of transmission at a playground. Do you know what the outcome of that investigation is, or if it's still going?
I don't have any details on that today, but I'm sure I can get you that.
Minister Foley, sorry, just one quick question. The opposition's going hard today on the FOI document with that found there were breaches in hotel quarantine, I think 3,000. What's your response to that? Are there going to be any changes? Are there any changes being made at the moment? What's your response?
So the hotel quarantine processes that have been put in place under CQV are based on the fact that if you see an incident, report it. This is the kind of standard health IPC and safety measures that we have in our hospital system and that we now rigorously enforce and is supported by our CQV staff. So that's normal, and I welcome the rigour in which our CQV processes are put in place, from the most minor of incidents to significant incidents. That's exactly what we want, and that shows the system is working.
How many are considered major?
I don't have that material, Nick. I'm sure we could get that for you, but this is precisely the system working and the fact that we've seen CQV step up and support, for instance, the Afghan flight the other night in such a seamless way shows how well CQV are delivering their services.
Do you have an update on the pressure that St Vincent's Hospital is under? Have any extra staff been put into isolation or anything?
I know that there have been some impacts at St Vincent's, but in terms of the particular arrangements, I'm sure we can get those too.
And the impact on the Royal Melbourne Hospital?
Yes, well, so that's a sensible move to be taken given the number of people who have been potentially exposed and the risk-based approach to making sure that we protect our staff, our patients and the wider Royal Melbourne community. That is, as a result, seen the furloughing of a large number of staff, which has had an impact on the Royal Melbourne's capacity to deliver the full range of services. We've been working both with the Royal Melbourne and the wider health services to flex in support in other locations, and that's involved for a period of time Ambulance Victoria rediverting elsewhere. We're hopeful that the measures that the Royal Melbourne and the wider health system have in place will continue to see the whole health system continue along and meet its obligations.
Will those diversions continue?
They'll continue on and off for however long the Royal Melbourne's advice is that it needs to be in place. And so far, the system is coping well. I want to thank the Royal Melbourne for its efforts. It's a seriously professional trauma hospital that provides key services, and as soon we can get those services back on full throttle, we certainly will.
Just got some quick questions for Naomi, if that's okay, for some people watching at home. They were getting messages this morning saying that they were ineligible to get the Pfizer vaccine. Has that been fixed, or was that just a glitch due to the number of people on the website?
The system change was made at 7 a.m. this morning, so some people who were jumping on, and we know there are a lot of people jumping on the system at 6:45, for example, that change would not have gone through until 7 a.m, so that might be what you're referring to.
And for those people that haven't been lucky enough to score an appointment yet, what's your advice to them? Do they keep refreshing? Do they stay on the page? What do they do to get to that next stage?
Keep trying. So if you haven't been able to get through the system this morning, or if you've grown a little bit impatient, that's understandable. Try again this afternoon, but keep trying as well in future days. So there are always more appointments coming into the system. For example, the people who didn't turn up yesterday that the Premier talked about or might have cancelled their appointments, those doses aren't lost. We'll harvest those and reinsert them back into the system, and other people will have an opportunity. But as I said there, certainly this morning when I looked at the system, there were quite a few appointments left at some locations, particularly Melton and Wyndham.
And just to confirm, if AstraZeneca is the only option that's coming up to someone that is aged in that 18 to 39 age group, they'll still be offered Pfizer when they arrive at the hub?
Yeah, so we will honour AstraZeneca appointments for people in that age group, but that will cease at the end of today. So from the end of today forwards, if you book an AstraZeneca appointment, you will be offered AstraZeneca when you turn up. For those people who already have an AstraZeneca appointment in that younger age group, you will be offered Pfizer when you turn up.
And is there any way of families booking for multiple children at once, or just one at a time?
That's a really good question. We do have a group booking functionality. We are applying that to certain cohorts at the moment, but we do hope to make it available more broadly to the public. Another option for those families might be the drive-through. So if you book in at the drive-through and you have extra people in your car, they will be vaccinated. As many windows as the car has, that number of people can be vaccinated, but of course you shouldn't be carpooling with other households. But if you had 2 children, for example, or multiple people in your household, that is one option that's available.
All good?
Thank you.
Thank you. Talk about the weather. Hey, Dad. Yeah, thank you. Thanks,